It is February in Baltimore, and a chill wind heaves in from the Chesapeake. Night leaves the city reluctantly, and day dawns cold along the avenue where Billie Holiday sang her blues. Above the street, in a quiet room, Benjamin Williams begins his morning yoga exercises. With his body and his mind, he reaches for the stillness he can sometimes find within. Far to the south, in Peach County, Georgia, Elsie Hillsman reads her Bible. Her children and her husband are gone now. Soon, she will put down her Bible and move to the kitchen to prepare her evening meal. At an old bus factory, filled with yellow iron, silence, and shadows, Jack Taylor prepares for the arrival of the morning shift. Soon the whistle will sound. The day will begin. 3 different people, but there's one thing that binds them. They live in a unique epidemiological province of America called the Stroke Belt, a region of the southern Atlantic coast where the mortality rate of stroke is 50% higher than the rest of the country. Elsie Hillsman, Jack Taylor, and Benjamin Williams have hypertension, a disease that could kill them if they don't get help. Yet, because the disease has no symptoms, is a silent and secret killer, help may not come. And like so many others, they may die before anyone even knows they're sick. The Stroke Belt, a collection of communities, both rural and urban, reaching roughly from West Virginia, across the Appalachians into Virginia, the Carolinas, and on to the Georgia-Florida border. Here is both irony and enigma. Although the nation as a whole has seen a dramatic recent reduction in deaths due to stroke, a near 50% reduction, the problem in this particular region grows more and more prevalent and severe, especially among blacks, and no one knows exactly why. The answers range from social to environmental to genetic causes, even to the high percentage of certain minerals in the southern soil, or to such genetic factors as differences in left ventricular hypertrophy and renal vascular resistance that have been demonstrated between black patients and white. Smoking, obesity, and excessive salt intake have also been cited. Social causes such as overcrowding and poverty. If we can isolate these causes in the stroke belt, these findings can be applied to the fight against hypertension throughout the nation.
Since 1972, stroke mortality has been reduced by half since this National High Blood Pressure Education Program has begun. We're pleased with that result. But stroke mortality rates remain the number 3 killer of Americans today. When we look at where the strokes occur, they are in the Southeast. 155,000 Americans will die of stroke this year. This is true not only in the Southeast, but in other parts of the United States.
I think that people that are poor, that are deprived, that have to compete with the majority society to just survive on the lower end of the totem pole, that's probably a stressful type of existence. And at least we think this is associated with high blood pressure. It may be somewhat causative. We've done studies here in Baltimore, for instance, and we find that the poorer people, the more inner city people that are often black, less education, less economic resources, tend to have a lot more high blood pressure.
Blacks have twice the hypertension that whites do. They have about 2 to 3 times the stroke and 2 to 3 times the heart failure, maybe 15 to 17 times the kidney failure as a result of hypertension. The white population also suffers from the disease of hypertension, just as the black population. It's a disease that affects people throughout the entire country.
There are some people who experience life with a keen sense of harmony and control. Benjamin Williams felt his mind and body were in balance. He had a good job at the post office. Life was good. Then one day, he went to the barber shop, and everything changed. In the Middle Ages, the local barber was also the local surgeon. The barber performed minor surgery as well as haircuts, and was at the very center of the healing arts. In the 18th century, the professions of barbering and doctoring went their separate ways. Now, in Baltimore, things come full circle. Doctors and barbers have joined forces again to do something about the terrible statistics of the stroke belt. How do you reach young men like Ben Williams, who feel in perfect health, yet carry their hypertension around like a lighted fuse?
No, men go to their barbershops about 10 times per year. And when they're sitting in the barber chair, they're in an ideal position to get their blood pressure checked and to receive health information. As a black male who was doing nothing about his high blood pressure, Ben was probably a good candidate for a stroke eventually. However, as a result of him going to get his haircut one day, he got his blood pressure checked. He was referred to a physician. He was able to get his blood pressure controlled.
How's your pressure?
Detecting people who suffer from this silent killer is often just the beginning of the battle. Equally as difficult is the problem of compliance. A major reason for the compliance problem has been the side effects of drugs prescribed to control blood pressure. In the 1950s and 60s, many patients frequently experienced bothersome side effects: muscle weakness, fatigue, headaches, frequent urination, dizziness, and impotence.
Today, the doctor can choose from so many medications that he can surely choose one that the patient will not have a side effect to, and which will at the same time be an effective drug. Also important in drug therapy, besides side effects, is the issue of compliance. Does the patient take their medication?
I always say that compliance is a two-way street. Sometimes doctors throw the word around very loosely that it's all a patient responsibility. It certainly, we think that people are largely responsible for their health, but physicians have responsibilities as well.
Return to me in 7 to 10 days so we can check your blood pressure again.
Okay.
Okay?
Right, thank you,
Good
Doctor.
seeing you again.
Okay.
Bye-bye.
Elsie Hilsman has lived in Peach County all her life. Her parents lived here, and their parents before them. Her son is pastor of the local Baptist church. She has many grandchildren, and most of them still live among the orchards and pecan groves of Peach County. Little changes in Peach County, or in Elsie Hilsman's life. Tonight, she will dine alone on the traditional fare her people have preferred for 5 generations or more.
We came to America as slaves, and our masters possibly ate a great deal of pork, and the pig ears, the chitlins, and the parts of the pork that they did not want, they gave to us. And we learned to cook those parts very well, and we learned to like them. And this is the way that we got to eating a great deal of pork. And then the pork is cured with salt.
Although hypertension can strike people of all ages, the problem is especially prevalent among older black women like Elsie Hilsman. They often have little opportunity for exercise, and with their steady diet of fried, high-fat foods, they tend to become overweight. The combination of weight, lack of exercise, and diet makes them a high-risk candidate for hypertension and stroke. And since Elsie Hillsman doesn't experience any symptoms, the disease progresses undetected.
We found that in churches that black people tend to have a great deal of confidence and faith in the minister and in the things that take place within the church. This is where our roots lie. And when we feel laden with a lot of problems that hurt us and a great deal of pain, then it's a church where we go to release this. People have faith and confidence in Reverend Hillsman. He's a saver of lives and of souls as well.
You're kidding yourself. You're kidding yourself. You are kidding yourself. You cannot live any kind of way and maintain your health.
In 1980, Dr. Madeline Chenault initiated a program called CHIP, Community Hypertension Intervention Program. The goal was to reduce the prevalence of diastolic blood pressures greater than 104 by 50% in 5 years. Using rural churches as a means of reaching the people, the program was not only highly successful in its 4-county Georgia area, but has become a model for blood pressure control in rural counties throughout the nation. It was this program that probably saved Elsie Hillsman's life.
This is the #1 killer of us blacks, so we need to do something about that. What can we do? We're here at church. We're here where we're safe. So let's band together. We are not going to infiltrate our bodies with a great deal of fat and a lot of salt, because we know that those are killers.
Jack Taylor has worked for the Bluebird Bus Company as a supervisor for 20 years. It seems to Jack the company has been part of the community forever, and it almost has, since before he was born, since 1926, when the first school bus rolled off the line. Because the major population in the stroke belt is black, sometimes we forget that white people are also at risk here. Jack Taylor was at risk because many of the causative factors associated with hypertension, such as high salt, high fat intake, are shared by both races. Dr. Daniel Nathan and the Bluebird Bus Company formed a unique partnership based on a recognition of their mutual responsibility to the community. Not only did Bluebird provide a facility for screening, but they provided a nurse, Esther Barker, who helped organize educational programs and who followed up on hypertensive patients.
About 3 or 4 years ago, my friend Jack Taylor, who has had no medical problems at all, was picked up by Ms. Barker as having a heart problem. He had an elevated blood pressure and he had some chest pain. He was hospitalized and found to have mild hypertension with coronary heart disease. Ms. Barker checked him regularly for his hypertension, which was very well controlled. He is doing full-time work, opening the plant, starting at 7 in the morning, working a full day. He's still active as a county commissioner, active in his church. He is an active, salvaged individual. To be a good physician, one has to be involved in all facets of life in the community. That means not only to practice medicine, but to be involved in all projects that would enhance the health of the community, the growth of the community, and the viability of our community.
Carrots and broccoli. Physicians that are practicing in the country today do so because they have a compassion and love for their patients. They work very hard at reducing morbidity and mortality rates, controlling the hypertension that we have in this nation today. It's that competitive edge that they use. It's that push, it's that drive that we work towards in terms of improving hypertension control programs.
More and more local doctors are taking up the battle against hypertension in their communities. Among them is Dr. Patrice Body, who has a private general practice in Sparta, Georgia.
People here are very distrusting. I think that the main thing involved in a rural setting private practice is maintaining a rapport with your patients. I have, I guess, about 70% of my patients over 40 come in with hypertension. It's incredible, but all of their friends have it, and so it's the norm. People here don't understand, and I know that they can understand, but it's going to take time. I want to stress the importance of education.
Emily. Parts of the sphygmomanometer are the bandage-like cloth, which is the cuff that encloses the rubber bladder. The rubber teeth, they're stronger and they're more...
Dr. Jack Burge, a family practitioner in Carrollton, Georgia, was terribly concerned about stroke facilities in his community. Too many people were dying needlessly. He decided to try a unique idea. Maybe, he thought, we can get the children to help us save their parents' lives. With the help of the American Heart Association, information about the heart became a part of the curriculum, and school children were taught how to measure their parents' blood pressure. The 5th grade children were found to be remarkably proficient. The pilot program was so successful that it has expanded now to some 300 schools throughout the country.
We were talking about how can we educate the public. We're in a small community here and without a lot of resources. So we decided that the most logical way would be to go through the conventional educational system that every community would have, and that's the schools. I remember well, shortly after the program began, a Ms. Marlowe, a patient of mine, had been for several years, came dragging her 5th grader into the office. Little boy, red-headed, freckle-faced, and he almost looked like he was afraid of what was going to happen next, because his mother actually angry. She came up to my office and then stood in front of the desk and said, "This young man says I have high blood pressure." We measured her blood pressure, it was elevated, and she said, "Well, I'll be damned, that's the first thing that kid's been right about this whole school year." Well, good morning. If the doctors in this community cannot help solve health problems, what other resources do we have? Are we going to wait for an outside agency of the government or of some private agency to come here and solve our problems? And of course, that isn't reasonable. Too many of us in private practice of medicine pay attention to our own practice and don't look at what our community needs from a health aspect. I think this is where the medical profession has got to take the lead.
Well, we know that if we go into a community and screen and do no follow-up at all, regardless of the community, that will not work. Hypertension must be detected, it must be referred to a proper source of care, it must be given proper treatment, and long-term maintenance and follow-up must occur. Those 4 things have got to occur. If any one of them do not occur, control will not work, regardless of the situation.
There are a large number of people out there, mostly black, mostly inner city, mostly poor, that have not been treated, detected for their blood pressure, and that are in need of care, and that are going to die and are dying every day.
One of the most important ingredients to a successful community program in controlling blood pressure is physician involvement. And physicians who get committed, who get the community behind them, and who put forth the effort in organizing the community, I think they are able to make a major impact in a very broad way.
So I think that is the real challenge to all of us, to give something back to the community in which we live.
Programs become innovative and successful because of local interest. The doctors have to want to do something.
He still is looked up to by patients and by the public as the leader. So he has to probably contribute a lot of time and effort that he may not be compensated for. But that's his mission in life. As people tell me when I say sometimes that how hard my life is, they said, no one made you become a doctor.
Hopefully, as more and more people learn about hypertension, as more programs are developed in the local community, as more doctors reach out for imaginative and innovative solutions, the power of the silent killer stalking the stroke belt will be diminished. Soon it will be spring in Baltimore, and to the south where the Hillsman House stands firmly on the good Georgia soil. Farther away still, the Taylors bless the season, the food, their faith, and each other. The day is good. Life is new. Tomorrow will be fine.
This looks good.
This program has been brought to you by Merck, Sharp, and Dome.